Sometimes cold symptoms can be confusing, and they could be very mild, and it may take a day or so in some patients to know whether it is a cold, infection, or an allergy. A cold is largely made up of hundreds of different viruses, and most common, 50% of the time, especially in adults, it's a rhinovirus. There's many different types, and that's the bad news, that you can have a cold this week and next month have another cold. A cold usually kicks in pretty abruptly. You may feel lousy, sore throat, runny nose, not feel yourself, fatigue, achy, feverish a little bit, and that comes in very quickly, over 12 to 24 hours. It also resolves, for the most part, 5-7 days, you start to feel better, and it may last up to 2 weeks. With allergies, it's completely different. There's no fever involved. It's not an infection. What it is, it's an immune response to things that are normally harmless, such as pollen, molds, dust mites, and so forth. So with allergy, it comes on in a pattern. You're in the park on a high pollen day. You're exposed to a lot of tree pollen, and we know through testing you're already sensitive and ready to react to tree pollen, and the reaction occurs. The most common allergy symptoms, whether it be a seasonal or indoor allergy, would be sneezing, runny nose, nasal congestion. That's the #1 bothersome symptom, nasal stuffiness, that leads to poor sleep at night. Itchiness of the eyes, watery, puffy eyelids, and so forth. Itchiness is one of the big differentiating symptoms between allergies and a common cold. Itchiness of the eyes, itchiness of the nose, along with other typical symptoms, sneezing, runny nose, postnasal drip, and so forth, itchy red eyes. All of these things go along with seasonal allergies, or even year-round allergies. Allergies are more prevalent during the seasons: spring, summer, fall. Colds are more prevalent clearly during the fall and during the prolonged winter period in many places where we spend a lot of times indoors and we're exposed to cold viruses. If you have persistent nasal symptoms, sinus symptoms, headache, fever, see a doctor, see your provider, have an examination. Colds are largely supportive care. That means there's no magic bullet. There really is no fix. I'm a big fan of nasal saline sprays when you have mucus to thin out the mucus, promote better drainage in your nose and sinuses, and avoid complications such as a sinus infection. Allergies, so many wonderful solutions in terms of prevention and proper treatment that will reduce symptoms that really work.